Hi there. My name is Dr. Paula Krepstad. I'm the Chief Medical Officer at Hope for Healing, and the reason you're watching this video is we are preparing to launch ozone therapy in our clinic. I've wanted to do this for several years now, but now that we've got our team trained, we're ready to go. So people say, well, what is ozone? Usually we think of it as something negative. The ozone layer has been diminished from all the pollution. Be careful when you're outside, like an ozone warning. But that's not what I'm talking about. Ozone is a triple oxygen molecule. It's a gas and it's heavier than air. It's very reactive. So that fresh smell that you smell outside after a rainstorm is ozone. Ozone is used in many different capacities, but it's usually to sterilize and clean things. So why is it such a big deal, and why is it so useful, and how come we haven't heard anything about it? Well, one of the very first ozone generators was made by Nikola Tesla, and he invented alternating current, which is now in every single home in the United States of America and around most of the world. Dr. Kellogg, yes, of Kellogg's Corn Flakes, also used an ozone generator, and this was being used prior to the invention of antibiotics, but then everybody started using antibiotics for bacterial infections instead of ozone. So now that we have so many superbugs, so many bacteria that are resistant to so many antibiotics, we need other tools in our toolkit. We take blood out of the body, usually about 60 milliliters for an adult, 30 milliliters for a child, and put the ozone gas into it. The ozone goes in there, turns the blood beautiful red, and then we give it back to you. But we also pass it through ultraviolet light of several different wavelengths. UV A, B, and C. C is germicidal. Some of the blood is exposed to the ultraviolet light. It won't harm it, but if the ultraviolet light is able to irradiate a certain number of red blood cells. So basically, what am I saying in English? We are passing light through the blood in order to kill or start a toxic chain reaction where these organisms die. Ozone also stimulates the production of good cytokines. Cytokines are magic messengers in our immune system. They're very small. There's good ones, there's bad ones. So initially the immune system is stimulated, then it cools down a little bit and ozone knows what to do. It's like God's perfect molecule because it goes to where there's inflammation, and we know inflammation is hot, red, swollen, or painful. But if you can't unzip your brain or your gut and show the world how inflamed it is, the ozone gets there. There's many different ways to administer it. You can bubble it into the ears. You can put it up the nose. You don't breathe it into your lungs. You hold your breath if you're old enough to hold it in your sinuses. You can even put it in saline and put a very low concentration into the eyes to halt and hopefully reverse the progression of cataracts. So ozone prevents you from aging, helps with detoxification, helps eradicate infections, and it is an amazing therapy. Ozone can be bubbled into the ears through a little stethoscope for 2 to 4 minutes, or we can use a syringe and put it into the ear and hold the ear. We can put it up the nose while you have your mouth closed and one side stopped up. You hold your breath. You can do it rectally and vaginally. Rectal ozone, you use a little catheter and you put the ozone gas up your bottom, and then it's absorbed into the circulation, and it's about 90% as effective as doing it in the blood, but it's slower to get there. Also, if a person has a rash, we can put a special silicone bag or well, actually it doesn't have to be silicone, over their limb and bubble the ozone in there. If you have varicose veins, we can inject the ozone there. If you have, eventually we'll be doing joints, but we're not doing that at this time. You can also administer ozone through olive oil. The ozone produces something called ozonides and terpenes, which are very healing. So if you have asthma, if you have a sinus infection, if you have marcons in your nose, these are all different ways to administer ozone. A little bit of information about what ozone is good for. So if you're fatigued, ozone stimulates the mitochondria to make ATP to give us energy. So if you're fatigued, if you have chronic infections, ozone is excellent for that, and it can be administered any different route that we've talked about previously. Autoimmunity, it's profound for that. If you have pain, your pain is decreased with ozone because you're delivering oxygen to the tissues and stimulating the immune system to heal you. Ozone is excellent for elevated liver enzymes. It's excellent for autoimmune encephalitis of the basal ganglia, like PANS or PANDAS. The thing that I'm most excited about for ozone and ultraviolet blood irradiation is for all of our patients that have tick-borne illnesses or vector-borne illnesses like Lyme disease, Bartonella, Babesia, anaplasmosis, toxoplasmosis, patients that have HPV, patients that have HIV, patients that have hepatitis, patients with herpes outbreaks, people with shingles. This therapy is absolutely amazing, and I can't wait to see how it helps you. As far as general pediatric goes and primary care, if you have asthma, ear infections, sinus infections, and for our patients with mold illness, chronic inflammatory response, biotoxin illness, using ozone to treat marcons is also a great new tool in our tool belt. So many of the patients in our practice have SIBO, small intestinal bacterial overgrowth, or SIFO, which is small intestinal fungal overgrowth. Ozone delivered rectally and by ozonated olive oil capsules is a great way to treat this. Thank you so much for your time, and we'll be talking to you more soon.